I'm here for another unpresented story. I call it unpresented because we belong to a network of age care organizations. Actually, we are a network member of HelpAge International. Of course, the challenge is that people don't think that we are a country office of HelpAge International. We are not. We are a national age care organization. We are not a country office of HelpAge International. We just affiliated to that organization, and the founders of HelpAge Ghana 32 years ago decided that we can take care of our older people the Ghanaian way. Of course, the disadvantage then is that during crisis like COVID-19, the dollars and the pound sterling never flow into Ghana through HelpAge Ghana. But we are very grateful that the COVID-19 Trust Fund came to our aid. Unprecedented, because HelpAge as an organization is not a large relief organization. And this is the first time we've been given the opportunity to actually impact on older people on that large scale. And it also posed some challenges, but we're able to overcome. We don't run homes, we run day centers. Our work is largely in the community. In Accra, we are affiliated to 22 communities, and we use community volunteers for care. So immediately the donation arrived, we categorize our older people into 4. First one are those we have adopted. We have older people yet to trace family members and carers, and they are totally on us. Every month, you have to find a way of taking care of them. We call them adopted granny. The second group, and these adopted granny are people who are on us. So what we did was that we just separated some of the food items we got to take care of them for 3 months. We started from May to July. The second batch is those affiliated to us in the 22 communities. The third batch was that we thought, as a national age care organization, we shouldn't restrict this relief to our communities. So we added 16 more communities in the greater Accra region to reach out to older people. And then the last batch are older people we encounter as we work. And even community members. In some of the communities, we have some, like this morning, research was showing people who have lost their jobs. We have others who are on us because they have children and they don't have means of taking care of them. So we were forced to go out of our way to provide for those families for the sake of the children and sometimes for the sake of the other family members. By reporting on our older people, we were able to take care of 4,793 individual older people. And I'm calling individual older people because they were those we were counting, but the relief actually affected households. The relief were for households. So 4,793, including members of the geriatric wards of Accra Psychiatric Hospital. We've adopted that ward. So we identify volunteers in all these communities, and these volunteers identified poor older people, including those who are bedridden and will never be able to come out to even be identified or seen for food aid. So when we enter the community, we have 2 badges of supply. Those able, who we give the aid at a venue, agreed venue, and then volunteers also carry packages into the homes of older people who cannot move physically to give it to them in their respective homes. We also got support from the Medical Association, Ghana Medical Association, the Women's Wing, who provided us with face masks. So all older people we serve at least got 2 reusable face masks. We have the Seventh-day Adventist Church coming to our aid with sanitizers. So we also supplied them with sanitizers. And all community activities proceeded with education on the safety protocols of COVID-19 in the local language. So if you are a community with Ga as the dominant language, the Ga language is used to educate the community members on how they can keep safe from COVID-19. And we were so anxious because we know the relationship between this pandemic and older people in terms of vulnerability. So the education was quite serious for the community members to keep themselves safe. One or two challenges, but we were able to come out of it, further strengthening the public-private or government-civil society partnership. The first one was storage facility, because we are not a large-scale relief organization where to keep the items was an issue. We got in touch with the Roverman Production, Uncle Ebo White outfit, who had a facility near us, and opened the rehearsal hall for us, where they rehearsed for the play, and we kept it there. Then the other bigger one is now the logistics, the packaging, the fuel, the vehicle to take them to the communities. So we also got in touch with one of our long-standing supporters, Relish Ghana Limited, Atosu, through Mr. Lawrence Addo, who provided us with some money to buy the other logistics required. The other challenge we have, which is another national problem, is the politicization of everything we do in the garden. And that normally ends up we getting a very high level of inclusion and exclusion margins in social interventions. So we got to communities, and already some political activists have already prepared their own information, which sometimes took us a longer time to counter, to ensure that this is Ghana government, and this is COVID-19 National Trust Fund, partnering HelpAge Ghana, and it has got nothing to do with politics. So you encounter communities where political parties have already prepared their so-called beneficiaries for us, as against what our volunteers have identified. And it was tough. It was tough, but not strange, because that is somehow how we've been able to color our social interventions, which is one reason why we're not making the expected maximum impact. And for we those in that sector, for example, if you take LEAP, it's a big issue. Recently, I was involved in a research in Ghana West and Shao Sudoku, and it was not palatable the way we are able to use politics to distort and divert and dilute impact on the poor. And this is one thing we were able to overcome. But in all, we became a very unique organization in Africa, because apparently in all the countries in Africa, this type of partnership was yet to show up. Governments were doing their own thing. Civil societies were doing their own thing. And actually that was how we started. Where we were going into homes, we have some older people who rely on us 100% for their medication. And even during the lockdown, we have to ask permission from the police to deliver medication to homes. But this one came and changed the situation. And we were being asked how, and if you can share the letter of application sent to the COVID-19 Trust Fund. And we're telling them that this was not an application. This was an organization which realized that there's a segment of the population very vulnerable and requires intervention, and has partnered with us. So we are grateful for the support. It actually portrayed Ghana also in a very positive light when it comes to aged care across the African region. And some of us who got the opportunity to engage in virtual engagement on the impact of COVID-19 on older people and how interventions impacted on them, we didn't waste time at all to tell them that in Ghana, there is a unique way of doing it. We just pray that we will carry this partnership nationally, so that at the end of the day, at least our older people will live a little bit more comfortably before they are called by their maker. I will say that we are very grateful, and when you get to the communities, you can have evidence. We've already shared photographs of our engagement with the trust, giving account, because every community, a volunteer signs and a sheet which acknowledges the food items, the quantities received, and then the number of older people taken care of. We saw people in the bracket of 60 to 103 years, 103 years in their homes. And they were surprised that in their homes, the government of Ghana was even thinking about them. We are very grateful to the Trust Fund for making this very, very possible, and all the other partners who join us. Thank you.